Hi everybody, I'm Dan. I have Dr. Bilski here today, and I think this is going to be an interesting conversation. Throughout our lives, for the most part, the majority of people are born with their teeth, and as you get older, if you maintain your teeth, that's great. Maybe you sort of partially maintain your teeth, like you did the bare minimum, and then this video is really kind of like on that tipping point when there's no return, right? And so like your teeth are just kind of like at the point that you've got to do something. So talk to us about that. Like, okay, how do we know when we're at that tipping point, first off, and then what can we do about it?
So the prevention and what Dan's getting at is maybe you've been struggling with, let's just say, bad teeth or gums, and you know it's coming down the pike. Do I pull my teeth? Do I wear a denture? Do I do dental implants? And some people are truly in between, and the question is, what do you want to do? And I think in most cases, if I could tell somebody, we can save most of your teeth or a few of these teeth and give you something that looks just as good as your natural teeth and certainly better than what you have now, what would be an option? And these are called locator snap-on dentures or bridges. And what that means is we can use portions of your natural teeth, attach these buttons that are bonded onto your teeth, and then a new bridge is made to snap on. So you take it in and out, clean it, but it snaps on. It doesn't stay in your mouth, which is okay.
Right.
But there's such a huge price reduction that it's an awesome alternative option. And we can transition you into things like dental implants. So say you have 10 remaining upper teeth and 4 of them are savable. The other 6 have to go. Well, it's difficult to try to restore that smile, give you what looks good.
Like consistent.
Yeah, so what do you do? And we pull them all and do 6 or 8 implants and then put porcelain bridges in. Very expensive.
Yeah.
Or can we do something with the natural teeth, which are called the root form locators? Maybe you need to have root canals already in those teeth, or we have to do that. Regardless, I can put these buttons on the teeth, make the new set of teeth, or the new smile, and we snap them in. So now what happens with those roots? Well, you lost all your other teeth, the other 16, you had 16 upper, 16 lower, you lost 12. Why would I think as a dentist you're going to be able to maintain it? Well, most people do. And when they don't, there are options to reverse engineer and place an implant in only one section or one tooth.
Right.
And we can still use the same teeth.
That's cool.
So
yeah,
I love it.
Yeah,
I love it. So.
I think that's great. I think that you're coming in at almost half the cost of some of these other procedures, but I guess I'm gonna call it Timetotooth because I don't really know what to call it. But so they come in, and how instant is that smile coming off that procedure?
Let's look at it this way. That smile has been in a terminal state.
Yeah.
I mean, if that was you, you'd know.
Right.
Most people know.
Yeah.
So, Doc, what do I do? Well, you can do this, or you can do A, B, or C. C is take them all out, put dentures on.
Right.
Removable, held in by spit, stick in a jar every night.
Right.
Most people, if they can get away from that, they do.
Yeah.
The other one is very expensive. And for half the cost, we can do in the middle or a little bit less or a little bit, depends.
Yeah.
But by saving your natural roots, putting these snap-ons in, snapping the teeth on. So if I told you it might take 6 weeks when you've been dealing with this for 3 or 4 years, what's 6 weeks?
It's not a lot.
Yeah.
Yeah.
The immediacy, and it depends on what type of personality you have.
Yeah.
But I think when you come to our practice, I think we do a pretty good job at education of what is your condition and what are the steps. And Dan, before you do this, let me just tell you, I'm going to see you 6 times over the next 6 weeks, and we're going to get this nailed down with old school techniques along with new technology with computers to expedite this and can kind of give you...
I think 6 weeks is a fair... is a fair time to wait. Like you said, if you've been dealing with this for years, in a short 6 weeks.
And that's
you
the
have a new
terminal smile. That's the
Yeah.
terminal smile. If
Yeah.
you're already wearing a denture
Yeah,
and you just they're not staying in, it's
Yeah.
usually the lowers.
right.
Well, in one appointment,
Yeah,
provided you have stable bone and the whole thing.
yeah,
But even if you didn't, you're
Yeah.
wearing a denture and I told you it's going to be 3 more months,
yeah,
put the implants in that case,
yeah,
we'll still use your same denture
Yeah.
if we can use it.
right.
And in 3 months, I can attach these.
Yeah, there you go, guys.
Pretty much going to do it.
So snap-on teeth, so to speak. Probably something you'd be excited about if you're in this situation, and Dr. Bilstein and his team can help you out. Thank you.
Come on in.